Today we will discuss about the thyroid gland. In this cadaver, we already discussed previously many lectures, and we already dissected this head and neck region. We have cut the skin incision from the symphysis menti to the suprasternal notch, and we have already reflected the skin of the neck region, as well as we have reflected the superficial fascia. Here you can see the portions of the platysma muscles, and there is a investing layer of deep cervical fascia. So most of the things, superficial fascia, investing layer of deep cervical fascia, everything we have removed here. And today we will discuss about the thyroid gland. Before we will discuss about the thyroid gland, I will show you the some structures which is superficial to the thyroid glands. Here, this is the sternocleidomastoid muscles, and this is the superior biliofomoid. This is the inferior biliofomoid. Now we will discuss about the thyroid gland. I will put the sternocleidomastoid muscles on the side, as well as you can see here there is a structure inside the carotid sheath which is already open. Now, for the visualizations of the thyroid gland, I will reflect these infrared muscles, and here you can see this is the thyroid gland. This thyroid gland, it is a endocrine gland which is nearly 25 gram in weight, and it extends from the C7 to C5 to the C7 or upper border of the T1 vertebral level. And basically we will discuss about the border and surface of the thyroid glands, and this border and surface of the thyroid gland, here you can see this is the lateral surface, and on towards the tracheal ring, it is the my forceps which is inside, and it is the medial surface, and another surface which is toward the carotid sheath, it is the posterolateral surface. So three surface: lateral surface, the medial surface, and posterolateral surface. It has a two border. Here you can see this lateral and medial surface which is on the anteriorly, which is meet at the isthmus, and this considered as a anterior border, and there is a posterolateral surface and medial surface which is meeting, it is the posterior border, and it is ill defined. So we will discuss about the relation of the lateral surface. This lateral surface, here you can see this lateral surface which is concerned with the infrahyoid muscles, and infrahyoid muscles, which is the first two layer, it is the it is the superior biliofomoid, and sternum to hyoid, it is the sternohyoid muscles. After reflecting sternohyoid, you can see there is a sternothyroid muscles which are the relation on the lateral surface of the uh, thyroid gland. On the medial aspect, there is a thyroid gland. It is related with the trachea and esophagus. So mainly upper pie tracheal ring, which is related with the medial surface of the thyroid gland, as well as there is a posteriorly, there is a pharynx and esophagus. It is related to the thyroid glands. On the posterolateral surface, so this is the relation pharynx and the trachea, it is related on the medial surface, and the posterolateral surface, here you can see this is an interjugular vein, as well as there is a common carotid artery, vagus nerve, and there is a sympathetic chain which lies posterolateral surface of the thyroid glands. So the thyroid gland, which is connected, the two lobe which is connected into the midline by the isthmus, and there is a apex which is extend up to the oblique part of the thyroid cartilage. So this is the thyroid cartilage, and it is the extend up to the apex which is extend up to the oblique part of the thyroid cartilage, and this thyroid gland which is innervated by the superior thyroid artery. So here some variation. Normally the superior thyroid artery coming from the external carotid, but in this cadaver it is arise from the common carotid. It gives initially superior laryngeal, which is goes along with the internal laryngeal, and then the superior thyroid artery it reach at the apex of the thyroid gland, and it divide into the anterior and posterior division, anterior division, which is anastomosis with the opposite side of the superior thyroid artery, and the posterior division, which is goes on the downside, and it is anastomosis with the inferior thyroid artery. Here you can see this is the inferior thyroid artery, and just below to the carotid sheath, this inferior thyroid artery, which is enter on the this inferior thyroid artery goes downside. Here you can see this is the inferior thyroid artery, and this inferior thyroid artery, which is ligated away from the gland, because near to the gland there is along with it there is a recurrent laryngeal nerve. So this is the recurrent laryngeal nerve. So inferior thyroid artery, which is the branch of thyrocervical trunk, and this is the thyrocervical trunk, and thyrocervical trunk, it is a branch of the subclavian artery. So this inferior thyroid artery, which innervate to the lower 3/5 part of the uh, lower part of the thyroid lobes, and always during the thyroidectomy you have to ligate the thyroid inferior thyroid artery away from the gland, because near to the gland it is along with the recurrent laryngeal nerve. Here you can also see there is a parathyroid gland. This is a very small gland, and here you can see this is the parathyroid gland. You can see here you can see this is the inferior parathyroid gland, and this one is the superior parathyroid gland. So whenever you can do the thyroidectomy, you cannot ligate the inferior thyroid artery uh, too much away from the thyroid gland, because the inferior thyroid artery, which also gives the near to the gland, it also gives the parathyroid branches. So whenever you can ligate the inferior thyroid artery, you also takes the uh, precaution that the blood supply impairment of the parathyroid gland will be not happens. And the other things, the superior thyroid artery, which is always along with the recurrent laryngeal nerve. Here you can see this is the internal laryngeal nerve, and along this internal laryngeal, and this is the external laryngeal nerve. This interlaryngeal and external laryngeal both are the branches of the superior laryngeal nerve. This external laryngeal always goes along with the superior thyroid artery near to the glands. Both are separated, and always you have to remember the superior thyroid artery ligated near to the glands, because at the near to the gland the recurrent laryngeal nerve, which is separated, and this recurrent laryngeal nerve, which is pierced external laryngeal nerve, which is pierced to the uh, this external laryngeal nerve, which is pierced to the cricothyroid muscles. And that's why uh, always you have to remember the external laryngeal and superior thyroid artery uh, together with the till up to the upper lobe of the thyroid gland, and then this external laryngeal, which is separated near to the gland, and it pierces to the cricothyroid muscles. So always the superior thyroid artery ligated near to the gland, while the inferior thyroid artery ligated away from the glands. Now, other things you have to remember: thyroid gland, which is covered by the two type of the capsules, the true capsules and false capsules. True capsules, which is formed by the condensations of the gland itself, and true false capsule, which is arise from the pretracheal fascia. And thyroid gland, the venous plexus, which is lies deep to the true capsule. So whenever we can remove the thyroid gland, we will remove along with the capsules. And when the prostate, we will remove, there is a venous plexus which is lies between the true capsules and false capsules. So always when we remove the prostatectomy, the capsule which is remain intact inside the body, only we will remove the prostate glands. So you have to remember this thing also. And thyroid gland, clinical aspect, we remove the thyroid gland either hemithyroidectomy or partial thyroidectomy when we require there is any tumor inside the thyroid gland. But you have to take the precautions of the parathyroid glands will be remain intact blood supply and inside the body because it maintains the calcium level. Thyroid gland, which is secrete the T3 and T4 hormone, triiodothyronine and tetraiodothyronine. Uh, Tetra means thyroxine, and it is controlled by the thyroid stimulating hormone. So this is about to the thyroid gland. Hope you enjoy the lecture of the thyroid glands.